Hey guys, before we get started, I want to get a definition and some acronyms out of the way. So today I'm going to be utilizing two techniques, a PNS, which stands for a pin and stretch, and an AET, which stands for an active engagement technique. I'm going to be using these to work on thoracic outlet syndrome, which is, if you don't already know, a condition in which the nerves and the blood vessels get trapped between the clavicle and the ribs and create a host of sensations down the arm, depending on the severity, but it's something that, as soft tissue experts, we can help. So without further ado, let's get started. So the scalenes, as you've probably already experienced, are not the easiest group of muscles to work on, and I like to approach them at the insertion on the first rib as best I can. So I'm starting here by pushing back the upper traps and addressing the anterior aspect of the superior angle of the scapula. And I'm using a pin and stretch, but my focus is mainly on the connective tissue that winds all the way up the lateral portion of the neck. So the scalenes start at the transverse processes and then come through this region and sink down into the first rib, and this is exactly where the chaos of TOS starts. I'm working my way lateral to medial as I start to sink in to get to that first rib, and that first pin and stretch that I did has a purpose. I want to start to clear away a lot of that congested connective tissue so I'm able to sink down deeper into that first rib and really address the scalenes. A pin and stretch here looks like this. I've brought her right ear towards her right shoulder, shortening the scalene muscles, and I'm using my fingers to sink down underneath the clavicle, pushing out laterally just a little bit down into that first rib. And once I've found that attachment site, I'm going to compress down and then use my left hand to pull her head again away from her right shoulder, stretching out those tiny little ropey muscles. An active engagement technique is a little bit trickier in this area because the scalenes do lateral flexion and rotation of the head and neck, but they're buried under bigger muscles that also do the same thing. So I'm going to focus on their unique ability to elevate the rib cage during forced inhalation. So I'm going to sink my fingers down onto that first rib, and I'm going to have my client take a really big deep breath. When she breathes in, I'm coaching her to sip in those last little bits of air as she's at the top of her breath to get the rib cage to elevate up to where I can really feel the scalenes contract. And then when she releases down, I'm sinking down a little bit deeper and accessing those attachment sites as they relax down and soften. This work can get a little intense, so it can be really helpful to offer some visualizations that your clients can practice while you're sinking in so that she can let go a little bit deeper. Some ideas for this area might be to have your client clench her jaw shut and then let it relax all the way, or press her tongue to the roof of her mouth and then also let that relax down all the way. These little engagements of muscles that are connected down through the neck and into the shoulder can help unravel the kinetic chain of this part of the body. Sticking with the theme of connectedness, I'm going to work my way up into the neck and start to work on the origin of these muscles. I've spent a lot of time down on the insertion, and now I want to get into the transverse processes of the cervical spine, which happens to be a tiny space with a lot of attachments, so needless to say, treat it with care. I'm going to start with a pin and stretch, so I'm going to soften the muscles by leaning her head over to the right, sinking the pads of my finger in towards the transverse processes, and then rocking her head over to the left away from my side of compression. This is kind of a mini version of a pin and stretch for a mini little area that's got a lot going on, so the subtle movements here are pretty powerful. You don't need to be huge and big and vigorous with this. Moving on to an AET, the same rules apply. This tiny area doesn't need a huge big movement. So I'm compressing down in towards those attachment sites, and then I'm having her bring her right ear towards her right shoulder, but just a little bit. The motion needs to be small, thinking more about the movement of the head and not the entire head and neck all the way over to the right hand side. Little muscles are more responsible for littler movements, and big muscles are responsible for big movements. So if you want to focus on little muscles, try having your client do little movements. I'm about to move on to the shoulder and the arm, but I want to remind you really quickly that if you talk to your clients about what you're doing, they're really going to appreciate how smart you are. So if you say something like, I'm really just releasing the splenius capiti cervicis through the scapular attachment of the scalenus of the nervous plexus and the brachial complex that runs through this area and region, you're going to be release the contracture of the area, they're going to love you. As you know, the traps are one of those muscles that doesn't just pull in one direction, it pulls in both directions. So it doesn't just pull the head and the neck to the side, it also pulls the shoulder up towards the head and the neck or the scapula back towards the spine. So if I'm working from this direction, standing at the arm and manipulating what the shoulder does, I'm able to access these muscles from a different perspective, hence getting a little deeper into this work. Starting with a pin and stretch, I'm going to focus on the levator scapula and the traps again, but instead of pinning them down and then moving the head away to stretch them out, I'm going to push the shoulder up towards her ear and shorten those muscles, and then pin them down with my left hand, and then use my right hand to pull the shoulder down away from her head and neck, creating that nice stretch. I'm a firm believer of using a global approach to an area, so you start to access these fibers from all different directions and you start to get into the nooks and crannies that you can completely miss coming at it from one approach. I'm going to do the same thing but just show you a different camera angle so you can see from my ceiling cam all my gray hair. No, I'm kidding. So that you can see the movement of the shoulder as I lift it up towards the ear and then pin it down and pull it away from her shoulder. I'm really creating a nice stretch in those muscles that gets kind of the lower fibers and the attachment site a little bit more deeply. And like I said before, you don't actually have to pin it down onto the skeleton. You can just grab the tissues with your hand. As long as you're creating a compression, you want to make sure that you are stabilizing one part of the muscle as you stretch the rest of it out. The bonus of grasping the tissues sometimes as opposed to compressing down is that I can manipulate them a little bit underneath my fingers and create a little bit of friction as I work. The AET in this position for the traps and the levator scapula looks similar to when I was sitting at the head of the table, but the big advantage from this direction is my own body mechanics. So instead of sitting and pressing in with my thumbs or my fingers to get that compression, I'm now able to lean back a little bit with my entire body weight, which is going to help relieve some of that tension on my own forearm so that I can create maybe a deeper pressure if my client is requiring a lot more force. So same idea as before, instead of compressing down into the scapula, I'm grasping the upper traps and the levator scapula fibers and using that compression against her contraction of those muscles as she elevates the shoulder, and then when she releases, I can sink down deeper and flush all of that out. The other really cool part about addressing the upper shoulder from this direction is the ability to wrap my fingers around the clavicle and address the scalene attachments from this angle. So instead of sinking down into the ribs, I'm actually hooking up into the clavicle just a little bit so that the connective tissue that extends down from the scalenes and onto the ribs, it also does come up into the clavicle. And all of those tissues that for most people who have thoracic outlet syndrome or many shoulder, neck, and head dysfunctions, there's gonna be adhesions in here and there's gonna be some contracted tissue that has not let go for a long time. Hooking my fingers underneath the clavicle and clearing away a lot of that congestion is often something that has not been tapped into and can sometimes be the key to a lot of relief. Just to clarify, for the pin and stretch, you want to shorten the fibers by bringing the shoulder up towards the ear, sink in with your fingers underneath the clavicle, and then stretch the fibers out by pulling the shoulder down away from the ear. And then for the AET, which I'm doing here, sink into the fibers, have her take a nice big deep breath in, and like I said before, sip those last bits of air in at the top of her breath so you can really feel the scalenes contract. And then when she exhales, sink down into those fibers, do a little extra work, and pull everything out down the arm. Working my way down the anatomical ladder, so to speak, I'm going to start working into the pecs, but I usually like to clear some space in the shoulder before I do that. Because the pecs cross over the shoulder, I just want to give the shoulder a little traction and prepare the pecs for the work I'm about to do. So this first pin and stretch is grasping the tissues, not pushing them down into the rib cage, but making sure that I'm using my finger pads and my thumbs to grab onto the pecs, pull them away from the rib cage a little bit, make sure that her arm is really letting go, and I'm using my left hand here to bring her arm back out into extension and abduction, which is going to lengthen the fibers of the pecs. So I'm pinning them down and stretching them out as I move her arm around a little bit like she's doing the backstroke. This time I'm going to pin her muscles down against her rib cage using my palm. I don't want to be too sharp here, mainly because the pecs are superficial and the PEC Minor, which I will get to in a little bit, is underneath that, and I want to stay focused on the PEC Major. So using my palm and moving her arm around still gets that nice pin and stretch. This is especially good if your client feels limited in their range of motion with their shoulder. If your client is a little more flexible and that first technique wasn't quite enough, Pulling their arm above their head and standing at the head of the table is a great way to access a little more depth into the pecs and get a little more range of motion with the arm. So I'm using my right hand here to support my client's elbow and using my left hand with either a soft fist or the pads of my fingers to sink down into the pecs towards the rib cage, and as I compress down, using my right hand to pull her arm up, creating a really deep stretch, especially in the lower fibers of the pecs. Speaking of which, keep in mind how big the pecs actually are, and if you move your hand around a little bit, you're going to access all the different fibers, and that of course is going to be beneficial in encompassing the muscle as a whole. Switching back yet again to the grasping technique, I'm using that side of my first finger and my thumbs to hold onto the tissue as I use my right hand to let her elbow drop down and stretch those fibers out. Again, be sure to move your hand around and get all of those fibers. They will love you. The last muscle that I'm going to address that's going to put this thoracic outlet syndrome package together is the PEC Minor. So I've really loosened up the PEC Major, and now I'm ready to sink a little bit deeper and get to that muscle that is so small but so powerful. So if you think about the fact that the origin of this muscle is on the ribs and the insertion is on the coracoid process, which is part of the scapula, its action when it contracts is going to be to bring the scapula down into depression, so pulling the shoulder down away from the ear essentially. Working with that knowledge, a pendant stretch is going to look like this. I'm sinking into the PEC Minor with my left hand and using my right hand to push the shoulder up towards the ear so that this muscle stretches as the scapula slides up away from the rib cage. As for an active engagement technique for this tiny little powerhouse, it's kind of like I've saved my favorite technique till last. I love to use this and find that it creates such a big change in my clients that they really notice. Okay, so I'm sinking into the PEC Minor again, and then I'm going to ask my client to take her right arm here, create a fist with her hand, and punch her hand down towards her feet. So she's really actively depressing her shoulder and pressing her shoulder down towards her rib cage, which this is what the PEC Minor does. So while my client's brain is asking these tiny little fibers to contract, I'm creating an outside force that's going against exactly what is happening on the inside. So it's that same idea of when a muscle contracts and then it relaxes, it has to relax beyond its normal state of relaxation. So as I create an outside resistance against this inside force, when it relaxes, my outside force is going to take over and get down to a deeper level and start to shift things while this muscle is in this really great state of being nice and loose. One more quick tip for the PEC Minor: if any of this work is too intense, you can just kind of sink in and have your client take a nice big deep breath. The rib cage is going to expand and you're going to get some stretch of the PEC Minor with that. So work with what your client is able to give you and make sure that you are working with what you can give to your client. When you're done with that work, be sure to flush down the arm and into the hand. Thoracic outlet is felt at the hand, so make sure you connect all of that and make that expert work that you've just done feel complete. I make the products I use in my videos and in my practice, and I make them because I love them and they're looking for a good home. So if you're interested, click the link in the description below.